Hello and welcome. Today we bring you Professor Salim Surani, who has been a long time GRSP supporter, faculty members, and a published researcher. He published quite a lot as well. He recently published his book. One of the books, he has published quite a few of them. So congratulations, Dr. Surani, for publishing a recent book.
You ask us to share what it is to about writing book or book chapters. So I think I'll try to go with some of the very high point and overview and what can be done, what needs to be done, and what is going on in the.
Right, this is a fantastic overview of the book writing, editing, and especially when you write a book chapter as a student. So my probably summary question to you is, what are the top one or two or three mistakes people do when they are asked to write a book chapter? And I know you have covered some of it, but if you can highlight very briefly, what are the top three or one mistake the junior researcher or junior authors do it when they're asked to write a book chapter?
So number one mistake they do is they don't read the instructions to the author. So their formatting is off, their fonts are off, their selection of the what they are using in New Times or Roman or whatever the other formatting they want is off. Their referencing style is off. So I think this is a key factor, which is a very big turnoff because the editor or publisher know that, oh my God, we have to do a lot of work. Second thing is, they need to make sure that they use some software, even the free Grammarly or something, just correct the simple errors that will go a long way. Third thing is, I think I've seen some folks who have, I'll give an example, in IPF, they have to write a chapter on genetics. It turned out that it was a 5,000 word and about the genetics was 250 words and 4,750 words were, which is all introduction, clinical feature, diagnosing, what that has already been covered with the other chapters. So then, you go back to the author says, hey, we need to cut those things and focus on, because, when we do the chapter, we are inviting them. So the peer review process is not like we are nitpicking on everything because they're all content expert we are inviting. But on the other hand, if that thing has already been addressed and the topic which you have given is not addressed. So I think concentrate on the topic. For example, if you're in the medical therapy of treatment of pulmonary hypertension, then focus mainly on that. The other thing can be very specific. So there was another, give you an example, future implications. So that was a 3,000 word chapter somebody has written, and future implication come out towards the end as one paragraph. That was not the intent. The intent was that whatever is going on in the pipeline, whether the new research or anything, because the other things have been addressed. So I think a lot of the most common mistake when they write for a book chapter, they're writing as if they're writing a manuscript, which is a standalone.
Absolutely. That's a great point. Let me ask you this. You've worked with several hundred authors over time. What are the three qualities you can describe in some of the most productive authors you have worked with, the book chapter authors, especially the junior investigators or junior researchers? What are the top three qualities you would bring out that these are the three qualities you really liked in that particular author?
So I'll tell you, if somebody sends me a chapter, I usually will give them a feedback in less than a minute. So obviously you can imagine that if you have a 4,000, 5,000, 8,000 words, I can't read or nobody can read it in a minute. But when you look at it, first of all, you look at the formatting, referencing style, and then you also look into the table and the figures. So I see that there are a lot of figures there, but there is no mention whether it's created by their own or created by someone else. Then second thing is I look into it if it is a hard copy and they have like 15 figures and they're all color. I know that if they're a junior author, it would be very tough for them to have an institutional funding to get all those things. So then I immediately reply back to them, hey, so if I see somebody who has looked into it, whether it's an ebook, hardcover, softcover, or their formatting style, table, and figures are okay, which I can scan in less than a minute, then I start reading. And if they're following what their task is assigned, so you will have an introduction which covers the beginning, and then they go into take and dive into their topic, for example, surgical treatment of pulmonary hypertension. So they dive into that, and they go into the treatment, whether it's creating kind of opening in the atria, whether you're going into a transplant, whether you're going into a pulmonary endarterectomy. They go into take into each of the section and dividing. So I think if the authors are clear in what they're doing, first of all, they create an outline. I always tell them, follow the instruction to the author, create an outline, and keep in few things. If you look into a chapter and you pass the first smell test in 1 minute, you know that you're going to be more inclined to do that. Otherwise, what you're going to do is they've written it, and then you keep on diving and you keep on sending back and forth, back and forth. Obviously, they've been invited, you deal with that, but when you're writing the next book, you're going to choose a path of least resistance where you have to do a less work with them.
Absolutely. So I think the authors who are listening today is that, making sure you're reading the instructions, making sure that you're responsive to the comments being provided by the senior editor, and then doing the timely work. I think those are three qualities would definitely help your editor or somebody who's invited for the book chapter as well. Any wisdom from you, those who are looking to what has been it for you? Why people should write book chapters, or they should write books and all, how rewarding it has been for you, and why the youngsters should continue to do that, or at least write a couple of chapters in their early part of their career.
I think it's a labor of love. That's number one. You got to love what you do. Second thing is, in medicine, everyone is seeing the patient and treating the patient. What makes you different from anyone else? Even if you're an academic world, and if somebody is doing work, maybe has published a couple of papers, you have published a couple of papers, it gives you more diversity. And again, it also validates you as a content expert, because you're not going to be getting invited unless they feel that you have some expertise in that area. So I think this is one of the tools which gives you self-satisfaction. You're trying to share your knowledge, you're trying to share your expertise, but at the same time, that is going to, in a tight area, that is going to differentiate you from rest of everyone else.
Thank you, Dr. Surani. This was very helpful. Thank you for so much for being here today and helping us out with understanding how the book writing works. And we have to bring you back for more detailed discussions and other topics as well. Really appreciate you being here today with us.
Glad to be here.